Hey, Josh here. Since the beginning of 2020, the WHO and Fauci have been at the forefront to resolve this worldwide pandemic. But in the process, it has created the idea that science doesn't need to be questioned and that whatever science says goes. Is this really true? How should science be conducted? And should scientific discoveries be challenged? Let's find out. So the idea for this video came to be because of one person. Can you guess who? Dr. Anthony Fauci. Specifically when he said this.
A lot of what you're seeing as attacks on me, quite frankly, are attacks on science. Because all of the things that I have spoken about consistently from the very beginning have been fundamentally based on science. Sometimes those things were inconvenient truths for people, and there was pushback against me. So if you are trying to, get at me as a public health official and a scientist, you're really attacking not only Dr. Anthony Fauci, you're attacking science. And anybody that looks at what's going on clearly sees that. You have to be asleep not to see that. That is what's going on. Science and the truth are being attacked.
I'll talk about a few things he said during that clip, but first we need to know what science is and its purpose. Merriam-Webster defines science as knowledge or a system of knowledge covering general truths or the operation of general laws, especially as obtained and tested through scientific method. One possible mistake people make when discussing the truth related to science is that science does not aim at establishing immutable truths and eternal dogmas. Its aim is to approach the truth by successive approximations without claiming that at any stage, final and complete, accuracy has been achieved. Based on this, questioning and doubting scientific studies is to be called for, which doesn't make you a science denier. It only helps you get closer to discovering the possible truths. That's what science do all the time. They ask questions about something, make a hypothesis about possible outcomes of an experiment, and find out if their theories are true or not. Another mistake people need to correct is when they choose to trust science and when not to. An article titled "Why Doubt is Essential to Science" states that the confidence people place in science is frequently based not on what it really is, but what people would like it to be. Students, when asked, would define science as an objective way of discovering certainties about the world, but science cannot provide certainties. For example, a majority of Americans trust science as long as it does not challenge their existing beliefs. To the question, when science disagrees with the teachings of your religion, which one do you believe? 58% of North Americans favor religion, 33% science, and 6% say it depends. When Fauci says that things based on science are sometimes inconvenient truths for people, according to these statistics, he's right. But can you blame people for being skeptical about the truth coming from Fauci? Let me explain. So I'm paraphrasing Fauci when he said, if you are attacking Dr. Anthony Fauci, you are attacking science. This is very similar to something else he said on a separate occasion.
So if they get up and criticize science, nobody's going to know what they're talking about. But if they get up and really aim their bullets at Tony Fauci, well, people could recognize there's a person there, there's a face, there's a voice you can recognize, you see him on television. So it's easy to criticize, but they're really criticizing science because I represent science.
Not everyone has been criticizing Fauci because it's easy, but because they accuse him of misrepresenting science by using it to lock down and mask up the world because X study says so. These accusations are mostly because Fauci has backtracked and flip-flopped on multiple truths.
Science is a liar sometimes.
These two articles list the 20 plus times science got Fauci wrong. Fauci got science wrong. Maybe they're both correct because Fauci is science, right? Well, let's think about it hypothetically. If Fauci is the literal embodiment of science, then when Fauci basically said, "I am science," yeah, that would be true. Except the only problem with that is that Fauci gets a lot of things wrong. For the hypothetical to be true, he would need to be 100% accurate. See, the thing is, the actual truth of the universe that we know of doesn't change, at all. Only our discoveries of possible truths change, and it's through our flawed scientific theories, studies, and results that cause our perception of the truth and reality to be incorrect and to change. What a weird hypothetical.
You can say that again.
Fauci did talk about how the discoveries of science changes, which was before the first clip that I showed you at the start of the video.
At the time that we were saying we shouldn't be wearing a mask, there were three factors that were going on. A, there was thought to be a shortage of masks. B, there was no evidence that masks worked outside of the context of a hospital. Thirdly, we were not aware of the extent of asymptomatic spread. So we said you don't really need to wear a mask. So as we went from January, February, March, April, it became clear that those three things, A, there was no shortage and you could wear a cloth mask. B, the data showed that in fact, outside of the hospital setting, masks do work. And third, to our painful awareness, it became clear that 50% or more of the transmissions were with people who had no symptoms. So that's when we said, we've got to get people to wear masks. That's what's called, Chuck, the scientific process. You make a recommendation, an opinion, and a guideline based on what you know at a given time. As a scientist, as a health official, when those data change, when you get more information, it's essential that you change your position because you've got to be guided by the science and the current data.
Fauci's right. When the science changes, when there's more verifiable information, there needs to be a change in position. Otherwise, you're doubling down on possible misinformation. I'll talk a bit about that later. With how Fauci handled the lockdowns and masks, he should have clarified that the recommendations shouldn't have been mandated. Basically, treating the scientific guidelines as advice rather than fact that must be obeyed without fail. To know why science shouldn't be blindly believed, let's look at one of the worst times the science being promoted was entirely wrong. For decades. Most of the US population, including doctors, regularly smoked in the 1930s and 40s. When people started asking questions about the health risks of smoking, tobacco companies launched advertising campaigns that targeted and referenced physicians. These advertising campaigns successfully manipulated influential doctors to promote that smoking was healthy, an effective treatment for throat irritation, and physicians were persuaded to prescribe cigarettes for sore throats and coughs. Even though many scientists said otherwise, tobacco companies mainly only promoted unscientific studies for their own financial gains. When looking at the past few years, does it make you question whether something similar is happening today?
No one would make that connection.
Pharmaceutical companies like Pfizer made $3.8 billion in 2021 from the Pfizer vaccine and funded dozens of mainstream media companies to promote their vaccines as safe and effective, as I discussed in my previous video. Many independent doctors and scientists have been urging people against the COVID vaccines, with one reason being that no long-term side effects studies were available. If you don't know what the long-term side effects are, you cannot guarantee that it's safe. This is what a lot of health officials were doing. Are the pharmaceutical companies manipulating health officials and other scientists to promote their vaccines? Are both of them working together for their own financial gains? Or are there any other reasons? If this video gives you a new perspective, consider pressing the like button. Therefore, it can help others gain fresh insights too. Thank you. Here's a quote from someone that you might know. We should be on our guard not to overestimate science and scientific methods when it is a question of human problems, and we should not assume that experts are the only ones who have the right to express themselves on questions affecting the organization of society. Unfortunately, social media platforms like YouTube don't understand this, as YouTube doesn't allow content that spreads medical misinformation that contradicts local health authorities or the World Health Organization's medical information about COVID-19. This is limited to content that contradicts WHO or local health authorities' guidance on treatment, prevention, diagnosis, transmission, and the existence of COVID-19. They do, however, state, we may allow content that violates the misinformation policies noted on this page if that content includes additional context in the video, audio, title, or description. Additionally, context may include countervailing views from local health authorities or medical experts. Fauci says that he and the CDC make a recommendation, an opinion, and a guideline based on what you know at a given time. But when he's one of the top health officials constantly making recommendations for the entire world, he must be very careful about everything he says, because governments and the public blindly follow the science and do everything Fauci says. Have a look at this meme. Also, because of fact checkers, I should state that Fauci didn't recommend people jump off a hill.
Obviously.
When Omicron was first discovered, governments responded by locking down their countries and stopping flights to and from Africa, even though they didn't have much or any evidence to support their actions. Dr. Angelique Coetzee, who was the first doctor that discovered the Omicron variant after treating patients at the epicenter in Africa, said that the symptoms of the virus are extremely mild. At the time, she was the most knowledgeable doctor on the variant, but not many governments and the public wanted to listen to what she had scientifically observed. This leads us to an issue that scientists these days can have, and Alan Savory, an ecologist, explains it in the documentary called Return to Eden.
What is science? People talk glibly about science. What is science? People coming out of a university with a master's degree or a PhD, you take them into the field and they literally don't believe anything unless there's a peer-reviewed paper. It's the only thing they accept. And you say to them, but let's observe, let's think, let's discuss. They don't do it. It's just, is it in a peer-reviewed paper or not? That's their view of science. I think it's pathetic. Gone into universities as bright young people. They come out of them brain dead, not even knowing what science means. They think it means peer-reviewed papers, etc. No, that's academia. And if a paper is peer-reviewed, it means everybody thought the same, therefore they approved it. An unintended consequence is that when new knowledge emerges, new scientific insights, they can never, ever be peer-reviewed. So we're blocking all new advances in science that are big advances. If you look at the breakthroughs in science, almost always they don't come from the center of that profession. They come from the fringe. People see it differently. The finest candle makers in the world couldn't even think of electric lights. They don't come from within. They often come from outside the breaks. We're going to kill ourselves because of stupidity.
To be clear, if health officials did their research as thoroughly as possible, but there was information that was impossible to know for whatever reason, okay, there's not much they could have done. However, if they didn't do their due diligence and change the policies soon after, that's on them. That's their fault. We previously discussed how science is never absolute, so it's not a good idea to blindly believe it 100%. However, science can be used to find approximate truths. When a new theory achieves all the successes of the prevailing pre-existing theory, it explains things the old theory couldn't, and when a new theory makes predictions about things that have never been observed before, and those predictions are tested and proven to be true, it replaces the current theory and becomes our new approximation of a scientific truth. That is, as long as the theory has been tested exhaustively for a reasonable amount of time. People that question science aren't science deniers, because if that were the case, scientists would be science deniers as well, because they're always questioning everything, or should be anyway. It's more so that these people think about science like this. I do trust in science, but coercion is not science, withholding data is not science, manipulating data is not science, cherry-picking studies is not science, social conditioning is not science, fear-mongering is not science, and censorship is not science. Okay, so as I'm editing this video, I found this in my notes on my old computer that mostly stopped working a few weeks ago. I sadly don't remember where I got it from, but it reads, "It is important to understand that science is based on empirical evidence and rigorous experimentation, and that well-established scientific theories have been repeatedly tested and validated over time. When new evidence comes to light, scientists reevaluate their understanding and make necessary revisions to their theories. It is important to distinguish between questioning science and denying science. Questioning science is a healthy and essential part of the scientific process, while denying science is rejecting well-established scientific knowledge without evidence or scientific reasoning. In today's world, there is a lot of misinformation and pseudoscience being spread, and it is important to be able to distinguish between credible science and false or misleading information. Questioning science is a valuable and important part of the scientific process, but it is also important to understand the underlying principles and methodology of science, and to be critical of the sources of information. Due to everything discussed, is this possibly why people were attacking Fauci on the science or questioning the legitimacy of things related to the pandemic? Even though science is never set in stone and is constantly evolving, that's not always a good excuse when Fauci gets the science wrong. So when he, supposedly one of the world's top health officials, misrepresents the fundamental purpose of science and misleads people when saying that he's science and science is the truth, what does that tell you about him? Here's my previous video questioning if fact checkers are trustworthy, and this is YouTube's recommendation. Thanks for watching, and I'll see you next time.